Thanks, Tracey. While we wait for our moderator to work out the technical challenges. My name is Susan Anenberg. I'm an associate professor at George Washington University. Welcome to this session. I'm the first speaker of 4, I believe. And we will be talking about some applications of using satellite data for air quality and health. And it is my pleasure to get us started. I'm going to share my slides here. So I'll be talking about tracking air pollution injustice. Get some windows out of the way. Air pollution injustice with satellite NO2. And I wanted to introduce the TIGER team, the NASA Health and Air Quality Applied Sciences team, TIGER team that addresses this topic, satellite data for environmental justice. I co-lead this TIGER team with Chan Chow. And we're at about the midpoint of this TIGER team right now, which is a little bit hard to believe. But we have 2 objectives. First is to meet stakeholder needs for identifying communities disproportionately affected by environmental health risks. And second is for estimating the benefits of governmental investments in environmental improvements for disproportionately burdened communities. And given that this is a relatively nascent application of satellite data, we also want to build capacity among the environmental justice community for using and interpreting satellite data sets. And also, this is really a two-way street. We want to learn from the EJ community too, to ensure that the way that we are developing satellite data sets of air quality and other environmental variables are actually of use to this community. And given the breadth of information that we have from satellite data and potential applications of it, we wanted to make sure that we have a narrow enough focus that we can accomplish something tangible within this time period. And so our focus is incorporating satellite data into environmental justice mapping tools. This is essentially the bridge that we're trying to, the gap that we're trying to bridge here, that we have very granular information about pollution levels like nitrogen dioxide and PM2.5, as well as other environmental conditions like heat and light at night. And we have full geospatial coverage of this from satellite data. And this is just a snapshot of nitrogen dioxide from Tropomi, developed by Dan Goldberg and Gage Kerr, which shows high NO2 concentrations around warehousing activities and around Interstate 95, which connects DC and Baltimore, which allows trucks compared with a parallel roadway, which prohibits trucks. And this provides information with full spatial coverage and more up-to-date information, more real-time information that then is currently possible with the data sets that are used in the environmental justice mapping tools currently. So I'm going to focus the rest of my talk today on nitrogen dioxide specifically, and let me address why I think that studying NO2, especially from satellites, is really beneficial. First of all, space-based NO2 columns are very highly correlated with ground level concentrations. And so this eliminates some of the challenges that we have with other air pollutants like PM2.5 and ozone, and possibly also some other environmental conditions. Nitrogen dioxide is also a tracer for urban traffic, and this is very important for environmental policy planning. You know, in places that we have put in place air quality management systems across the country and in individual cities, we can actually use NO2 to track how pollution is changing. Is the air quality improving in response to policies? Or it could go the other way, is air pollution increasing in response to new emission sources that weren't there before. NOx emissions are, of course, also precursors to PM2.5 and ozone, which are the largest contributors to the burden of disease from air pollution. But NO2 itself is associated with asthma development, or at least is a marker for the traffic-related air pollution mixture, which is associated with new asthma development, particularly among children. So I think it's very beneficial to study nitrogen dioxide. I didn't know a few years back whether or not we could actually use satellite nitrogen dioxide to address environmental inequities. And this was a groundbreaking study that was led by Gage Kerr, which showed that we can use Tropomi NO2 to identify NO2 disparities across the United States. And this was actually consistent with several other studies that were coming out around the same time, but the first time that I saw, you know, we can really do this on a nationwide scale. We can see how the least white census tracts are experiencing NO2 pollution levels that are much higher than the levels in the most white communities before the COVID-19 lockdowns and during the COVID-19 lockdowns. And so this really was a groundbreaking exercise for me, at least, to show that we can actually use tropomi-NO2 to identify disparities. We wanted to take this a step further to say, okay, tropomi-NO2, we can use it to identify these disparities, but what about surface concentrations? What are the surface concentrations data sets that are informed by satellite data? What are they telling us about disparities? And so Gage has taken this a step further, and if you saw his flash talk from yesterday, you got a bit more detail about this. But we can use satellite-derived surface concentrations as well at the census tract scale, link it with demographic data, and show how both NO2 and PM2.5 disparities are widening across the United States. And Gage has shown that NO2 disparities are quite a bit larger than PM2.5 disparities, both in terms of concentrations and health effects. These novel data sets provide a means to assess NO2 levels at environmental justice relevant scales. So he has actually taken this, Gage has taken this down to the block group level beyond the census tract in response to some requests from some EJ mapping stakeholders. And we now have high resolution data sets that fuse satellite data with physical models and allow NO2 to be assessed for individual block groups. And these data sets are already available in formats that make it easy to integrate these into EJ Screen and other types of EJ mapping tools at the state and national level, which then makes it easy to explore inequities associated with this pollutant and compare with existing environmental indicators. I want to turn to who is receiving the benefits of reducing air pollution, because everything I've shown so far is identifying the disparities and making it easier to show where those disparities are happening. But as you remember in the opening slide, when I described the objectives of the Tiger team, there was a second objective to help stakeholders identify who is receiving the benefits of governmental programs, and that's in line with the Biden administration Justice 40 initiative. When we think about who's receiving the benefits of reducing air pollution from governmental policies, though, this is maybe even a step harder than identifying disparities, because here we have to actually simulate where air quality is improving in response to policies. And this requires modeling typically to go from emissions to concentrations. So a good example of this is that the EPA just in this past March proposed standards to reduce NOx emissions from heavy duty vehicles. And my personal opinion is that could dramatically narrow inequities in air pollution health risk based on what we know about NO2 disparities and the heavy duty vehicle contribution to them. But the EPA regulatory impact analysis, which estimates the costs and benefits of the regulation, while it did include a demographic distributional analysis of the air quality and health benefits, the full demographic distribution of the benefits is currently unknown because of the coarse spatial resolution of the chemical transport modeling at about 12 kilometers. There was no demographic analysis of the health benefits, and we know that air pollution is inequitably distributed, but that also compounds with the vulnerability of the population, that disease rates like asthma are also highly inequitably distributed. So we have to consider the vulnerability of the population in addition to the exposure of the population when thinking about the environmental justice benefits of the regulation. And finally, the regulatory impact analysis accompanying this regulation did not include nitrogen dioxide, which is the pollutant that, as I just showed you, is most inequitably distributed and also very highly affected by heavy-duty vehicle NOx emission standards. A key challenge is that we have computational limitations, so we can't just very easily run chemical transport modeling at, say, 1 kilometer spatial resolution, although we're beginning to be able to do that. A second key challenge, though, is that the chemical transport models need highly resolved emissions information, and the emissions information has to have accurately placed emissions for things like heavy duty vehicles for us to accurately assess where the improvements in nitrogen dioxide are occurring. And satellite NO2 can really be quite helpful in improving emissions inventories that are needed to simulate the effects of NOx reducing policies on air quality. Dan Goldberg will be speaking after this and talking about some of the work that his Tiger team and NOx emissions has been doing to compare tropomi-NO2 on stagnant days with current emissions inventories to try to highlight where the discrepancies are and improve emissions inventories that can be then input into chemical transport models. If you're interested in further information on this topic, I also wrote some public comments to the EPA with some other researchers, and the link is provided at the bottom of the slide. I'm so excited about future satellite missions that will bring improved capabilities for tracking health and environmental justice impacts of air pollution, and this includes both TEMPO and GeoXO in the 2030s. Dr. Kate Odell has a recorded flash talk on some of the work that she's been doing to estimate the value of geostationary satellite information on the atmospheric composition for health and environmental justice. And just to conclude with some key takeaways, just want to reiterate that it is possible to track air pollution and justice using satellite NO2. Satellite NO2 can also help us improve emissions inventories, which can enable evaluation of community scale air quality and health benefits of NOx reducing policies. These data sets are available now to be integrated into EJ mapping tools. And I'm very optimistic about the level of information that we will get from future geostationary satellites like TEMPO and GeoXO. If anyone is interested in getting involved in the satellite data for environmental justice type of team, please reach out to us, especially Gage Kerr, and we will talk with you about the ways to get involved. Thank you very much.
Thank you, Susan. And Tracey, just making sure, we'll hold the questions till the end.
Exactly. And we want to try to stay on schedule so we have a time for Q&A at the end.
Very good. So actually, Tracey will be our next speaker.
Thank you very much, Ted and Susan. Thanks for that nice kickoff. The work that I'm talking about today is largely done through the Tiger team that Susan and Qian are leading, but also tying together a number of different threads that have been going on in my research group for a few years and linking them with some issues and thoughts about potential for TEMPO. So I'm going to be talking about kind of 4 different projects, 4 different pollutants, hitting on, I think, some of the important ideas when we're thinking about how to really make the upcoming TEMPO data and the existing data products as valuable as possible for environmental justice applications. And as Susan mentioned with their work with EJ Screen, I think it's really important to be using known tools and platforms that are already employed by the communities we're trying to connect with. We want, one opportunity I think is very exciting is the potential of hourly formaldehyde from TEMPO to serve as an indicator of air toxics exposures, which is a huge issue for environmental justice projects. The NO2 opportunities from TEMPO really, I think, will inform not just the temporal variability, but will help us zoom in on spatial patterns that can get hidden in a once-a-day snapshot. And really, I think a big open question is, how valuable will the SO2 be from TEMPO at facility scales? So in one approach to, thinking about using tools and data that stakeholders are already using is just to be aware that, it's easier for us to get going with their data and tools or ones that they're recommending or excited about than to try to sell them on the models that we've happened to be using for the past decades or so. And an example of that for me has really been getting started with a model called InMap, where the development is led by a colleague of mine at the University of Illinois, Chris Tessum. And I heard of InMap from a stakeholder group focused on environmental justice called Fresh Energy, which is an energy company based in an energy nonprofit based in Minneapolis. And I started working with them with funding from the McKnight Foundation, and the Joyce Foundation. And Ben Passer, who had been at Fresh Energy, he expressed a real interest in us using InMap because it was developed specifically to support environmental justice applications and zoom in on the urban scale. And you can see here in the lower right corner what InMap looks like over Madison, Wisconsin, where you get resolutions down to 1 kilometer by 1 kilometer over populated areas. And InMap simulates annual average PM 2.5 along with PM 2.5 species. And so we started looking into InMap at the suggestion of Fresh Energy. And around that same time, then there was a paper that came out led by Dr. Tessum, and it was picked up by the Washington Post and the New York Times that really, I think, shined a spotlight on environmental justice issues around air quality. And this has just been increasing the partnership interest in this model, because now it's not only something that was designed to support high resolution and environmental justice applications, but also it has the awareness and something that they can like read that's accessible, not just a peer-reviewed paper. So, you know, this work that we did that was really started by a suggestion from Fresh Energy has led to some panel discussions and engaging new stakeholder partners like the City of Milwaukee Health Department, Langston Verdeen, and the Wisconsin DNR through panels. And we're working now with our local utility. So it's been neat to see how once we get a tool that was suggested, I'd never heard of it before, it's led to a lot of collaborations and new partnerships. But, and so here's data from the INMAP model over Houston. And I think you can see it, we're here compared to the percent people of color by census tract here in Houston. And we're showing it with sulfate PM2.5. And the good news is that INMAP captures spatial scales that are really essential for this kind of equity and health analysis. The bad news is that INMAP is underestimating sulfate PM2.5. And that's been shown in published papers about INMAP already. It's not new, but you can really see it here compared to the satellite-derived sulfate PM2.5 from Randall Martin's group at WashU. And one of the reasons why this underestimate is so important is because industry is a major contributor to SO2 emissions, and that's what you see here from one of my students, Jinran Wu. We're doing an analysis of the national emission inventory. And in many states, you know, here focused on the Gulf Coast region, because that's where we are, industrial emissions contribute the largest component of SO2 emissions. And I will confess that for years in my classes, I've been saying, oh, SO2 from coal burning power plants. But really, industry is a huge part of that, and a growing part as coal plants retire. And Chris Tessum's work, it published in PNAS, found that in INMAP, industry sources were the most inequitable source of air pollution. They had the greatest proportional impact on communities of color. Now, that's even with INMAP underestimating SO2 and sulfate in the model. So one of the things we wanted to do was to see if we could correct the model using satellite-derived data products. And this is the work of one of my graduate students, Kieran Gallagher, and another graduate student named Clara Jackson. So we've been experimenting with different ways to scale INMAP with the satellite-derived data products, which is something that can be done with the linear structure of INMAP in a way that I think will take this model that's already well suited for environmental justice applications and empower it with satellite-based information. So one of the nice things is once we have this corrected model, then we have more confidence in the source attribution and analyzing these what if questions about interventions at the city scale. And through HAQAST, one of the projects that I'm working on is with the American Lung Association. And they've given us a list of cities where they're especially concerned about environmental justice areas. And this is not necessarily their list of cities, but we are in the process of using the scaled INMAP data to support this work with the American Lung Association and showcasing how satellite data can take tools that were built without it and maybe take them to the next level. In a different direction, a major environmental justice issue are air toxics. And this was a project that was produced by ProPublica earlier this year that basically took information from the National Air Toxics Inventory and imposed a Gaussian plume and made these maps. I was not involved with this, but it led me to think, you know, how can satellite data help? And a couple of years ago, I've been working with a graduate student named, an undergrad at the time named Peidong Wang. He's now a graduate student at MIT. But we did an analysis of ground-based and satellite formaldehyde. And this was really inspired by some of the stakeholder conversations we've had through HAQAST. We're doing a lot with formaldehyde and nitrogen dioxide ratios, but there was this question of how well does the satellite compare with the ground-based formaldehyde monitors? And it was a good question, so we spent a couple of years analyzing it. The paper just came out earlier this year. But one of the interesting patterns came from just looking at the ground-based measurements. And what we found is that first of all, there are very, very few monitors across the United States that provide hourly data with enough data coverage to really discern diurnal patterns. But the 3 monitors that had enough data for us to feel like it was reliable to put it in the paper, 2 were in California, 1 was in Missouri. And the California monitors show a very clear diurnal cycle where formaldehyde is going up in the middle of the day and down. And that's consistent with what we would expect from biogenic emissions emitting during the peak of the day. Whereas in St. Louis, it's a much crazier pattern. And if you compare that with actually the emission inventories from the National Emission Inventory, you see that the contribution of biogenic emissions is much higher in California and anthropogenic is much higher in St. Louis. So one thing I'm hoping that someone does with the tempo data is to look at this new hourly formaldehyde data and see if we can finally put some information on the diurnal cycle and maybe even use the diurnal cycle as an indicator of anthropogenic versus biogenic sources. This diurnal cycle is a huge issue for NO2. Which we've also looked at in a paper in Environmental Research Letters. And, whereas we don't have a geostationary satellite now, of course, over the United States, but we kind of tried to patch together the 2 polar orbiting satellites, especially on days when their pixels overlapped. And what we found is that you can really see, even at the city scale, structure that can indicate sources and patterns. And then, kind of speeding up faster and faster as we're moving through the talk, but I'm very excited as well about the potential for satellite data to support SO2 analysis. And, we don't know yet how good the instrument will be, how good the retrievals will be, but SO2 is the only NACS pollutant that currently includes monitoring as part of the designation process and with an AirMod model. And this is sort of an example of what AirMod looks like. And this is at about a 2 kilometer by 2 kilometer box, which is comparable to the resolution we expect from tempo. So I think there's some excitement around the potential for tempo to support air quality analysis as well. So I'll just end here with a comment that, the kind of data needs that environmental justice organizations have are quite different than health and quite different than air quality management. And I think one thing that varies is the technical expertise. Another is the number and scale of resolutions and of organizations and partners, and also the scales of interest. Environmental justice is really even down to the facility scale. So I think it'll be real exciting to see how tempo can take on and meet these new information needs. Thank you.
Thank you, Tracey. A lot of neat ways to integrate the satellite data in the models. So our next speaker is Leticia Nogueira. So Leticia, you want to take it away?
Yes, I'll take it away. Can everybody hear me okay?
Yes, we can.
All right, great. So my name is Leticia Nogueira. I'm a researcher at the American Cancer Society focusing on climate change and cancer, and I'm going to talk a little bit about the environmental justice aspect of our work today. Climate change is the greatest threat to human health of our time. We know that, and it doesn't impact all of us the same way. There are 3 components that determine vulnerability to the health threats of climate change or any environmental hazard: sensitivity, or the degree to which climate hazard impacts humans. So if you have chronic health conditions, you're going to be more sensitive to environmental hazards. Adaptive capacity, or your ability to cope with climate hazards, and exposure, or the chances that you actually will get in contact with environmental hazards. and the intersectionality of different individual characteristics, including our perceived race, our gender identity, our socioeconomic status, our language, the languages that we speak, all determine our vulnerability to the health hazards of climate change and any environmental hazard. For example, in 1933, the federal government established the Homeowners Loan Corporation to expand home ownership as part of recovery from the Great Depression. HAQAST staff used racial composition as part of its assessment of areas that were worthy of receiving loans. They literally drew red lines, since the term redlining, around communities with large Black populations, flagging them as hazardous investment areas. Redlining reduced access to home ownership and deprived these communities of an asset that is central to intergenerational wealth transfer. This government-sanctioned practice validated other practices, including undervaluing of real estate in Black neighborhoods and mob violence against Black individuals who tried to move into white neighborhoods, leading to racial residential segregation, which formed a platform for broad disinvestment in previously redlined neighborhoods, from infrastructure, including green space, housing stock, roads, public services, including transportation, schools, garbage collection, and employment opportunities. Restricted access to resources limits the adaptive capacity of communities. It impacts people's ability to evacuate or stockpile food, for example, or invest in housing infrastructure, including insulation and air conditioning, which are important during heat waves, or special air filters during wildfires. Broad disinvestment in these communities also led to a concentration of psychosocial stressors and created barriers in access to health resources in these neighborhoods, including lower access to healthy foods, green spaces that promote physical activity, and clustering of alcohol outlets and tobacco marketing. These barriers to health led to an increased prevalence of chronic disease burden among individuals in communities targeted for marginalization, including high blood pressure, obesity, and higher prevalence of chronic health conditions can increase sensitivity to the health threats of climate change. Due to the lack of political empowerment, individuals residing in historically redlined neighborhoods are more likely to be exposed to environmental hazards, including air pollution, as we just saw, and also intra-urban heat. Impervious surfaces such as asphalt and concrete trap heat in urban centers, what we know as urban heat islands. And we know from using Landsat data that previously redlined neighborhoods display elevated land surface temperatures compared to non-redlined neighborhoods. We also know that communities targeted for marginalization are more likely to live in proximity to fossil fuel infrastructure, including oil and gas wells, refineries, coal-fired power plants, all of which release large amounts of pollution and other health hazards in these communities. It's funny that you showed that this method was created by ProPublica using EPA's toxic release inventory, which is not based on satellite data. Those are reports submitted by industry to identify areas with concentrated cancer-causing industrial air pollution in the United States. This is one environmental justice issue satellites, such as TEMPO, which I hear will be able to measure formaldehyde, and other air pollutants will be able to help us address, especially because this pollution doesn't stay in one place. Air monitors are mainly located in metropolitan areas. And we heard a lot yesterday about how we are using satellite data to improve air quality measures in areas that are far away from monitoring networks. So we don't know how many people are actually being exposed to this industrial pollution. Satellite data is already helping us understand how exposure to wildfires and the associated health consequences are not limited to individuals residing in Western states, for example. We are currently using satellite data to investigate the association between exposure to wildfire and lung cancer survival as part of our Tiger team with Dr. Yang Liu. Satellite data has been instrumental for this project because air monitors are usually located in metropolitan areas, while exposure to wildfires is more likely to occur at the wildland-urban interface. Similarly, exposure to industrial pollution doesn't necessarily happen where the air monitors are located. And satellite data could improve our ability to measure this type of exposure. And what can be measured can be changed, especially if we measure the extent to which people are being exposed in surrounding neighborhoods, not only in the communities targeted for marginalization. We tend to focus on these big federal and state environmental laws. However, land use planning, zoning codes, siting decisions, they're all done locally, and they all have tremendous environmental justice potential. This is where satellite data could be truly impactful. And we also know that exposure to pollution due to proximity to fossil fuel infrastructure is not only an issue for communities targeted for marginalization. We can see this in the industrial heartland of Appalachia. We have not been able to appropriately measure exposure to pollution, which could lead to change, even in communities that have access to resources necessary to organize and push government officials to find a solution. This map shows how none of the air quality monitors in West Virginia are located south of Charleston, where the coal mining industry is concentrated. And here again, climate change is relevant because it can increase exposure to industrial pollution. For example, climate change alters the behavior of extreme weather events, making it harder for communities to prepare and respond to increasingly unpredictable disasters. Warmer air holds more water vapor, which increases the water capacity of hurricanes. We can see that with Hurricane Harvey that hit Houston in 2017. This is a map from the National Oceanic, NOAA, and showing rainfall over Houston during Hurricane Harvey. New colors had to be added to the legend because it had never rained so much in one spot before. And Harvey's unprecedented precipitation, which climate change made 3.5 times more likely to happen, flooded chemical plants, oil refineries, Superfund sites, and released vast amounts of carcinogens in the Houston community. Also during Harvey, oil refineries shut down operations and start flaring their excess chemicals, which they do to avoid explosions. The problem is that flaring releases far greater volumes of toxic air pollution than normal, already polluting operations. And during what's called these exceptional events, oil refineries are exempt from fines they would have to pay for exceeding pollution limits. So they have no incentives for changing this practice. To make matters worse, we have no idea how much toxic air pollution is being released during these exceptional events because currently government agencies take down the air monitors to protect their equipment during these extreme weather events. So here again, using satellite data could be transformative. While most studies up to date on air pollution have focused on cancer risk, which takes a very long time to measure, we're just now starting to understand how exposure to pollution impacts cancer survival. Individuals diagnosed with cancer are a vulnerable population to environmental hazards because cancer diagnosis and treatment can lead to several physical, psychological, and socioeconomic consequences. Some chemotherapy agents can impact thermoregulation or lead to a weakened immune system, making individuals more vulnerable to infections, which are common during floods, for example. Cancer diagnosis and treatment also has socioeconomic consequences. Expenses that arise during cancer treatment and survivorship care, combined with changes in the ability of individuals diagnosed with cancer to remain employed during and after cancer treatment, are some of the ways cancer diagnosis is associated with increased financial hardship. And these socioeconomic consequences make it harder for individuals diagnosed with cancer to prepare and respond to disasters, very similar to the challenges that are faced by individuals from communities targeted for marginalization. At the American Cancer Society, we are very interested in understanding how climate change is impacting cancer survival because in addition to exposure to carcinogens, it can also lead to disruptions in access to care. And we're also interested in the intersectionality. So we saw how the intersectionality of different individual characteristics, including cancer diagnosis, can increase vulnerability to health hazards. But how does the overlap of several environmental hazards, such as heat leading to worse air quality, impact health outcomes among vulnerable populations? This is another question that satellite data can most certainly help us answer. So there's lots to do, and I'm looking forward to further discussion. Thank you.
Thank you very much, Leticia. And again, holding questions till the end. Let's move to Allan Just from Mount Sinai.
Thanks so much. I'm sharing my screen and switching my display. Let's go back.
Very good.
So I'm happy to talk. My group is doing some work in exposure disparities, but today I'm going to focus a little bit more on the health studies, and Tracey made a point that, different applications will have different things that they're focusing on. So today I'm going to talk a little bit about some of the opportunities and challenges when we're thinking about health studies and applications of Tempo. I'll give some examples from Mexico City. I also do a lot of work in the US with large health registries, state and national data sets. But I'm going to talk specifically about Mexico City, which is an area that's going to be covered by some of the unique capabilities of Tempo. And the megalopolis of central Mexico is, just this huge region that is known and has had a lot of air quality challenges, although things have improved substantially from the 90s. The improvement in the last 10 years has sort of leveled out a little bit. And there are lots of these what are referred to as environmental contingencies or policy actions, where there's attempts to limit traffic or other kinds of emissions, because there's exceedances in this bowl-shaped metropolitan area, very highly populous area. So my group has built satellite-informed models for PM 2.5. There's a lot of work on other pollutants like NO2 right now. And so we came out with this model a few years ago in ES&T, and I want to give some examples of how we've used this model and its descendants. So one example is Iván Gutiérrez Avila, who was at the National Institute of Public Health in Mexico and then joined my lab as a postdoc now. So he did a time series analysis using cerebrovascular mortality. So people who died of strokes, looking at mortality records, linking that back to the PM daily concentrations that we had constructed in our model with using one of the MIAC AOD was a major input. And what he found was that, for a 10 microgram per cubic meter higher PM 2.5, on the average on the day of death or the day prior, so that's called lag 0 or 1, there's associated with a 3.4% higher odds of mortality from stroke. And the confidence intervals on this were kind of wide, because this kind of time series was assuming that everyone in Mexico City's exposed to the same thing, sort of averaging everyone and only using data on when they died, right? So it's temporal information, but using this area level exposure estimate, even though our models were resolved, that data set wasn't. So one of the things that we're moving towards, and Tempo is, so we know that air pollution varies substantially in time and in space, right? And those are both really important attributes for us to consider in our health studies. And Tempo is really going to help us also with the temporal variability, thinking about how much variation is there during these daylight hours when we think about diurnal patterns like Tracey spoke about. And no one is breathing 24-hour averaged air. So there may be particular roles of thinking about peak exposures and their contributions to health effects. And one of the reasons that we do health studies is that we need exposure response functions or concentration response functions. We need to know what are the health impacts of having exposure at a certain level, and how do those health impacts change, also thinking about who is more susceptible, and does that mean that their slope of how concentration elicits a response, whether that response is something like experiencing symptoms, or going to the hospital or dying, right? How does that vary across the population? So one of the things that we think satellites are going to be really helpful for is focusing on temporal variation. And we use a epidemiologic design called the case crossover. And this is going to really be helpful when we're thinking about acute events and transient exposures, or exposures that vary substantially, over short periods of time. So an example would be that if we can reconstruct highly temporally varied exposures, we can link that to records of when people have had emergency department visits or hospitalizations or their death records. And then we can compare the exposure that those individuals had in the time prior to their event with matched control time periods. So you may have heard of a case control design where we compare people who have had a disease with other people that haven't had that disease. But in this design, people serve as their own controls. We're just picking other referent time periods. And often that matching is done within the same month. So for example, if you have a record of someone who passed away on a Tuesday, you might look at their air pollution exposures on the days prior to Tuesday, and then on the days prior to other Tuesdays in the same month. And that gives us an exposure contrast where we're looking for the distribution of exposures that come from the background from which these cases arose. So this case crossover analysis, it has some particular advantages. And it's important in health studies because the distribution of air pollution exposures is not randomly assigned. And that was a major point of these prior talks, right? It relates back to factors of structural racism with historic roots. It relates back to modern patterns of commerce and emissions. And so that's really challenging for these health studies because there's many other health-related factors that confound because they're related to both exposure and health outcomes. And so these within-person designs, particularly this time-based comparison, is really helpful at avoiding confounding by time invariant factors. So you don't need to know rates of smoking, right? Because for an individual, whether they're a smoker or not, you're making comparisons for that same person, thinking about their exposures at different time periods. And so spatial resolution here is going to help us with accuracy. But the comparisons that we're making in this design are essentially across time, getting at the question of why now? Why now are people showing up at the hospital with strokes? Why now are people suffering ED visits for asthma events? So here's an example of over Mexico City of a more recent model where we're generating 1 kilometer resolution PM2.5, but now we've constructed estimates for 667 sub-county regions where we're able to attach health records. And we're showing overlaid, even though this is PM and tempo is a lot of its work is focused on gases, we're showing the intersecting tempo cells to give you an estimate of how things look. And in fact, Mexico City is so far south in the tempo field of regard that we get slightly smaller pixel sizes than over some of the regions in the US that tempo is going to be covering. So when we take this kind of intersection of exposure estimated with registries of health, this postdoc, Dr. Ivan Gutierrez-Sevilla, was able to run this kind of case crossover that I described to you. And so he's working on this now. It's the largest acute air pollution analysis in Mexico because we're able to look at almost 1.5 million non-external deaths. So we're excluding suicides, homicides, and accidents. And we're looking across these causes of death, which lets us also think about heterogeneity, finding susceptible subgroups. When we think about demographic characteristics, such as age and sex, or we think about causes of death, by ICD code classifications, or when we think about other kinds of sociodemographic variables that hint at social determinants of health. So what he found, similar to that time series, but with much, much, much smaller confidence intervals, right? So tightening that up is going to help us when we think about health impact assessment, because we have less uncertainty in the concentration response function. Find stronger effects, again, for the same day, air pollution on that day versus earlier days, but overall the cumulative effect is quite substantial, thinking about PM2.5 and here non-external mortality, where we also see stronger effects when we stratify and look at older populations over age 65. Tempo is going to let us look at other air pollutants. And so I think a real opportunity is to think about mixtures where there may be synergistic health impacts. Being exposed to more than one air pollutant at a time is really relevant because no one's breathing air with a single pollutant. And so we may want to really improve our health studies to be considering that mixture of air quality, air pollutants and their impacts on health, so that air quality indices reflect the the true concentration response of being exposed to many things simultaneously because of the correlations that we know occur in the real world. So I want to finish with that and just say Tempo offers a lot of opportunities, and a challenge for health studies is going to be that it won't have that archive of old data. So we're going to have to wait for new health information to arrive, after Tempo starts its operational phase. So there will be a little bit of a time lag, but I think there's a lot of opportunities to think about peak exposures and exposure mixtures.
Thank you, Allan. And so with that, let's bring all of those speakers that gave some great talks back on, and they're available for questions. And what we'll do is we'll actually start off with the online questions, and then there's going to be a chance for the in-person individuals to ask questions as well. So the first question, and it says for Tracey and Susan, though I think it can be for others as well, is how, and this is from Jonathan Patz, how can the high resolution NO2 mapping that Susan presented improve it? They have here the InMap model that I would also indicate other models as well. Along with that, how can it help us understand, well, it says understand that PM 2.5 is more complex than NO2 measures. So maybe there's a little bit of apples and oranges between the two. And asked in a different way, if one was just focused on PM 2.5 from transportation at high geographic scales, which tools should a local official pick first? So Tracey and Susan?
Maybe I'll just start, since I work with Jonathan quite a lot. Hello, Jonathan. And, I think that which tool is best really depends, I think, on the specific question. And I think that's really where we're like an applied research team, because I think we want to make sure we're understanding the question. I think for the most part, most NO2 in the United States comes from the transportation sector. And so I think even looking at high resolution NO2 maps can offer a lot of information on transportation emissions. In terms of integrating with InMap, these are big questions, because InMap calculates aerosols, but the ingredients are often gases. And so actually, we've been thinking about this exact question of how to integrate NO2 data to improve InMap. But it's, the exact way you slice and dice would depend on what model you're working with. So maybe I'll pass it over to Susan.
Yeah, thanks, Tracey. And somewhat of a similar response, but I'll add a couple things, is that InMap is based on a chemical transport model, and our chemical transport modeling is only as good as the emissions data set going into it and our understanding of the atmospheric processes that translate emissions to concentrations. And so if we don't know the emissions of where the NOx are occurring very well, the model won't perform very well. And that's where satellite data can really come in to improve any chemical transport model by improving the emissions data set that goes into it, InMap included. And I will note that some of the analyses that have been done to evaluate InMap show that nitrate aerosols, the performance for nitrate aerosols is not as good as for some of the other aerosols. And maybe a reason for that might be our lack of understanding about where the NOx emissions are occurring. So I think it's really important that the satellite data can be used to improve those emissions data sets.
Thank you. And did any of the other panelists want to join in as well? Okay, so with that, this one's from Shobha. Susan, maybe you mentioned it and I missed it. Is the NO2 inequity trend 2010 to present shown due to changing demographics associated with white flight from urban areas?
Shobha, that's a great question. We're still sort of digging into this to try to understand it. Just a quick response is that NO2 concentrations have gone down for both the most white populations and the least white populations. And as a result, the denominator has gone down. And so the ratio is larger. As the concentrations go down for both groups of people, the ratio between them has widened. But we don't know whether that's because of the changing nature of where emissions are occurring or the changing nature of where people are living. And we will definitely be digging into this further.
Thank you. Do we have questions from the live audience?
had a comment on that topic area actually for Susan. Thinking about our current increase in the electric vehicle fleet, for example, in some of these areas around the US, I kind of wonder if that is actually, you know, enhancing this environmental justice issue in some of these urban areas with the increase in the electric vehicle fleet for some of these communities. Therefore, you don't have those same, the same fleet in some of these lower income areas.
Well, I think that's a part of it, that the electrification of the vehicle fleet tends to happen in wealthier areas. And so maybe NO2 is dropping for a number of reasons in the wealthier areas, perhaps. I am very, very interested actually in whether we can observe some of this mass electrification from space. There have been cities like Shenzhen, China, for example, that converted their entire municipal bus fleet and taxi fleet to electric. Is the signal large enough to be seen from space? You know, I think these are interesting questions that we can observe. We can try to, you know, dig into with the geostationary satellites.
Okay, we have another one online from Shoba. Allan, for the Mexico study, did the mortality estimates due to PM 2.5 level off at certain concentrations? And if yes, is Mexico different from other study regions if speciated PM is different in Mexico compared to other areas?
So for the second question, I would say, you know, there's a huge body of literature that both acute and chronic exposure to PM 2.5 contributes to mortality. And so every region is going to be different, both because of the composition and, you know, the health and of the underlying population and the other factors that impact human health and response, you know, when they have that exposure. So the answer is yes and no. When we've met with regulators in Mexico, they want epidemiologic studies that have taken place in Mexico. They don't want to extrapolate from concentration response functions from Western Europe and Canada and the US. So we are looking at that question about the linearity. I think that's an important question because you know, in the US, we often want to know what happens at low concentrations because we're trying to understand, you know, what is the basis for making regulatory suggestions. But when we do studies in areas that unfortunately have higher concentrations, we start to understand sort of where things head in that range, which is harder to do, you know, if you're doing most of your work, you know, in the Northeast US, which doesn't thankfully typically have such high concentrations. So, you know, on first pass, we were seeing things being fairly linear in the range that Mexico has, but it's actually has a distribution of exposures that doesn't really overlap with the US. So we, you know, again, that'd be hard to compare because the other determinants of health are kind of different. So it's a great question, Shoba. Ideally, satellite-informed models will help us do health studies in many places so that we'll understand these concentration response functions. And then we can do things like meta-regression, starting to combine information across populations.
Thank you. And we have a question that's coming from the in-person audience. It's in the chat. And this is thinking of Allan's point about the importance of cumulative exposure. Are we at a point soon where we can think of tempo and use satellite data to assess cumulative burdens, which is really what matters to communities? So I think this is getting to using the tempo data to look at the cumulative burdens. And
yeah, so I think that many indices that look at how bad things are making assumptions that they're additively bad, right? You sort of look at the badness of one factor at a time, and then you create an index that adds up that badness. But one of the things about thinking about mixtures, and that could be mixtures of pollutants or mixtures of the social determinants of health, right? Or mixtures of some of these climatic related risks, right? Extreme temperature as a physiologic risk also occurs on the days when we have some of the worst air pollution. And so those mixtures may turn out that having these co-occurring events, the correlated high exposure, means that the burden is even worse. And so that's important to discover empirically, and then to inform when we think about quantifying exposure disparities, that the exposure disparities are worse when you have the intersection of multiple environmental contributors and then even the non-environmental stressors.
Okay, thank you. And I think we have maybe time for one more. All right, I think not hearing one or seeing one. I would like to thank everybody. And if you note in the chat, Tracey has said likewise, thanks for coming. And we will see you in October, if not on the next session. So again, I'd like to thank all the panelists for a great set of talks, really laying out what some of the health and justice and environmental justice and how we can use tempo in the future. Thank you all very much.